Welcome, everybody. I'm Ray Barrett, the CEO of Telehealth Certification Institute, and today we are going to be covering the aspects or considerations for working with kids and adolescents online, so providing online counseling or therapy. And to cover this topic, I have brought in the expert, Dr. Yolanda Fountain. She is a registered play therapist. She's a registered play therapist supervisor, and she does everything you could think of in that scope. So she provides clinical supervision for play therapists, consultation. She's an educator, a professor at numerous universities in Georgia. She also provides play therapy herself. So she kind of, covers her bases with that. By the way, she is the developer of a play therapy certificate program that we host, which will be available shortly as an online self-study program that's going to be fantastic. So you can find her by going to her website. So what I'll do is I will show you that website of hers. There we go. It's Play Wellness LLC. So the website's very easy, playwellness.net, and we'll share that in the description. So Yolanda, thanks a lot for joining us.
You're welcome. Thank you for having me.
Yeah, and we get a lot of interest right now with how do we work with kids online and adolescents? What are some things we should consider? Does it work in the first place? Yeah, so I'll share one experience that I have is I used to do psych assessments, and I spent 3 years doing psych assessments through video, and many of them that I did were with kids and adolescents, and then I worked with some adolescents online, so I have some familiarity with that. But Dr. Fountain has a lot of experience with that. So in general, working with kids and adolescents online, what's been your experience and other people's experience like in terms of does it work?
I will say that it does work. Is it my first preference? Probably not, just because there's a lot more challenges and ethical considerations you have to be aware of. I love working with children and teens. I prefer it in the office. However, it works just as well online, so long as you're aware of certain parameters that can help you along the way. And if we as clinicians will keep in mind that it's about the relationship. And so whether that's in home, in office, online, ensuring that we have a solid, trusting relationship with the child and with the parents is more critical than anything.
Yeah, and so can you give us what's behind that with the concern about the ethical piece? Yeah,
So there are a lot of ethical considerations just for working with children in general. And also now working with children and teens online. And so one of the things that we want to be sure of is that parents are available, like that you're not the babysitter. And in case you have an emergency with a child, you need to be able to at least call them or get in contact with them via phone. So I always caution my parents to make sure that you have your phone on you and available and the ringer on, just in case I need you during our session if we're having a private one-on-one session with the child or the teen.
Yeah, a question I have about that is, how available do they need to be? Meaning, do they have to be on site? Can they be off site? If they are off site, do they have to be like within a matter of 10-minute drive? At what age level do you say, hey, you know what, the parent actually needs to be on site? Because even if I wasn't providing therapy, it would be kind of neglect if there wasn't a parent or guardian on site. Like, how do you make that kind of decision?
Yeah, so I'll tell you, and this is just my ethical boundaries. It may be different for other clinicians, but even when we were offering in office, due to pandemic, we're currently on hold with in office, but even when we were in our ethical guide, in our informed consent with parents, we informed them that they were to stay on site with their children when when the child was in the office, to be emotionally available. So the child may have some emotions and they may want to show the parent or something like that. And it's important that they're still available, even though they're physically separated. I'll tell you, in the past too, I've had, like, for example, a parent go off and get a flat tire. And that was, if they're my last client, that's problematic. It's like,
you want to go home.
Ready to go. And so and kids know, if their parents leave, that's the exact moment, that one session they want to show their parent that can build their mastery. And so it's important for parents to be emotionally available, whether that's in office and or in the home setting, and to mitigate those risks that you shared before if something was to happen. Now, the older they are, you can make some judgment calls. If they're 16 or 17 and they're pretty responsible, and they have no, depression or suicidal stuff going on, then, you might have a little bit more leeway there.
Yeah. So is there like kind of an age limit where you would say, hey, if they are under this age, then whether therapy is going on or not, or especially with therapy, there really needs to be a parent or guardian or responsible party, on site?
I'm going to give you my my educator answer as a professor. It depends.
Yeah.
I say go by your state law too. What is your state's law for under this age? You cannot leave this child at home. Mm-hmm. So if they're under their age, don't do it. And if they're above the age, it depends on their impulse control level, your judgment for their responsibility taking. So all of those factors will take place.
Yeah. Where do you know like what that kind of law would be called, or where people would find that in state laws?
Yeah. Actually, you can probably find it logged under the Georgia abuse and neglect laws. Because really, if you leave your child at home alone, that's under neglect.
Yeah, so it'd be, so whether any state, it'd be really under the like abuse and neglect kind of law.
Probably, but you can probably Google it now with whatever state you're in to see what that age is.
Right. Yeah, because one of my concerns would be, say there's other siblings at home, mm-hmm. and then a fight breaks out. Or like you were saying, say they start to decompensate because things are being triggered, and they start to act out. So, but then again, you want to provide accessibility, and then some states have laws where, well, every state has laws where there's a certain age in which an individual could seek psychotherapy on their own, and they have the right to their own medical records, and their parents don't have the rights to those records at a certain age. And that really varies. So for some states, it could be quite young, where, the child has the right to receive psychotherapy without the parent knowing about it. So, so those things have to be considered also. So it's good that you point out, like, hey, look at the state laws, but then also the clinical judgment in the situation. Yeah.
Mm-hmm. And so in what you were just referring to is the emancipation. So I have even worked with some teens who, were able to get emancipation by the state, depending upon their circumstances. Mm-hmm. And also if a child who is pregnant, or a teen who's, child who's pregnant is going to automatically be a defect report, but a teen who's pregnant, they can make medical decisions for their own child. And so it's a lot of different things that you need to be aware of when it comes to Georgia law and just working with children and teens in general, or whatever law you follow.
Yeah, and then probably one of the other things you're thinking about is, hey, you kind of alluded to this, I think, is kids and teens might do things or behave in a way online that they wouldn't do in your office. And there's benefits and drawbacks to that. One of the benefits is that they might be much more transparent, much more honest, be able to develop rapport quicker because they have more control over the situation, so forth. There's more distance. But then the drawback is they might be just double tasking or being inappropriate or in ways that are certainly not helpful to therapy. Any thoughts on that or experience with that? Yeah.
Yes, and to be honest with you, I'm finding it depends on the generation as well as the child. And so there are some children who don't want to be online at all. I mean, they're being taxed out from being lying on school, from being lying on other stuff, and they are tired of online forums. They're just tired. And then there are some children who love it, and then there are some children who are learning, and teens who are learning how to warm up to it. And so even with me and my supervisees, I've seen a great variety of how they take it. There's one of my staff, Miss Sarah, she's been educating me on how there's a generation that just is aversive to online stuff because parents have stuck their faces in online stuff for so long. They're like, no, I don't want to do that. I'll just wait till you get back in the office. So
yeah. So it really varies. So you really have to assess what's going to work best for that person. And in terms of like engagement, being able to move the camera around, being able to show you things, show their space, be in a space that they're comfortable with. I guess just the flexibility of the location and the convenience. And going along with that, I'm really curious, especially for adolescents, because I think adolescents, they really are in touch with the stigma of going to see a therapist. Not all of them. Some of them might be totally fine, but for some of them, the stigma, so not having to actually go to an office might help kind of protect them from the sensitivity to that stigma. So are there things that you do, like using online therapy to maybe increase engagement, utilize the tools of video, working with kids and adolescents, to get the most out of it?
So with children, I definitely use play therapy because that's their language. With preteens and teens, then I will actually use a more directive play therapy approach. And so instead of the traditional kind of child-focused play therapy, what I'll do is combine a evidence-based talk therapy with a directive play therapy activity. And so there's, arts or dance or whatever the child has that they like, they can actually show you, which helps build up their mastery as well as the relationship. So there's a lot of things in directive play therapy or sand therapy or drama therapy or art therapy activities that you can integrate with traditional talk therapy, because the teens, they're too old. They'll think the contents of play therapy is too little for them, but at the same time they're maturing and they may not necessarily always have the frontal lobe or the full brain development of an adult, so they're kind of in that in-between stage. So a lot of times combining those left brain approaches with those right brain approaches can be very effective.
Yeah.
And knowing, because I know you said about the space, they may feel more secure in their home, but I also know there are some teens who and even adults that I work with online, they're concerned about who can hear them. Right. And so they prefer to be in the office. And so, sometimes the options are using the phone, so long as they're not the parent, as a sound machine, or cutting on, I brought my sound machine from my office home, but I also have a loud bathroom fan. So I have the machine and the bathroom fan running, and between those two, you really can't hear a dog on me.
Right. And they can wear the earbuds.
Yes, earphones.
And for those that didn't understand what you may have said about using the phone as a sound machine, you can, if it's a smartphone, you can get an app, right? The sound machine app on your phone and just play that. Yeah, I love that. That works awesome.
Yeah, I'll tell you though, I did the earphones for the first few weeks after the pandemic hit, and I got an ear infection. So because my ears are so sensitive to different things, and plugs. So I've learned. So now I just have external barriers. So for those of you who have sensory stuff, but if not, yes, the earplugs are very safe as well to help to minimize any risk of overhearing.
Yeah. And then, you know, if you say you need to, like, if you're concerned about cutting or whatever, you know, it's important not to feel bashful about asking a kid to hold up their arms, you know, or be able to see their body. There's nothing wrong with that at all. I say that because when I did, you know, like I said, assessments for years and assessed a lot of adolescents and kids. So I would ask them, you know, hold up your arm, you know, let me see that, you know, how'd you get that? And, you know.
And I would say so long as it's not in a risky position. Because if it is somewhere that's closer to a private area, I would actually have the parent, have them contact their parent for me, because I know some teens who would cut closer to private areas just so that it can't be seen. And so that is definitely something you want to take into consideration. If you're working with that kind of risk, sometimes that's the challenge of doing the online work.
Yeah, certainly. Yep.
Because you don't want to, you know, any other kind of charges. And you shared about that online thing, just knowing that child perpetrators and sexual traffickers, they're on the prowl now that more children are online. And so parents have to be very conscientious about putting those parameters on their computers for protection as well.
Yeah. I had a client that I was working with that got caught up in that, and luckily it was caught, you know, last minute, luckily, by the parents. So those are definitely good things, important things to ask the kid. And not only that, they can show you on their screen. Like I shared my screen to show you Yolanda's website. So they can show you, like, what are they doing online? Because that has a big impact on them, their online activity, and you could really help educate them and inform them and guide them in terms of that online life. So yeah, they have, and it also gives them a sense of power, I think, like, because they can show you some things, right? Because now you're using technology. But again, we have to be careful of privacy and so forth, but they can show you things on their screen with screen share. Definitely. Yeah. Anything else we should cover?
I think that's a good sum.
All right. Yeah. Sounds good. Yeah. So Dr. Fountain, thank you so much. This has been very helpful. If anyone needs any help, or if you just want to run something by a clinical supervisor, Dr. Fountain's available at playwellness.net. So thanks a lot.
Thank you.
Bye-bye.
Bye.